reduce. So that has been our endeavor. This is our first step towards creating an innovation which could be potentially disrupt the way today some of the diagnosis is done today in the field. So I will come back on that disruption more in detail. But today, one of the things which I would say the differentiator for a company like CURA, because as you know, the technology, very little difference between various companies. The biggest thing I would say is the service, which is what I am proud of today. In fact, yesterday evening, there was a call at 8 p.m. A 3 Tesla MRI, one of the high-end machines, were down. And today morning at 3 a.m. the machine is up. I mean, there is absolutely zero downtime for the hospital or a patient. That's one of the key success factors for us. We have more and more happy customers. And as a company, we have evolved from a manufacturer today to an innovator. Okay? When I say innovation, innovation by either business model, innovation on product, innovation on meeting the unmet clinical need. Today, though in healthcare, medtech has advanced quite significantly in the last 10 years, but there are significant unmet clinical needs. Dr. Sandeep would explain during his course. But there are unmet clinical needs today, and one such unmet clinical need, which is what we are trying to solve through our innovation. So what is the challenge? Today in healthcare, there are multiple challenges. What is the challenge today we are trying to address? One of the big challenge is, if I go one step back, is in terms of, we know the infrastructure challenges in the country, the economics of how the number of investments made by the government is probably less than 1% of the GDP. So there is no proper screening happening today in India. Most of the screening happens only in very, very small percentage, I would share, only in the urban areas. In fact, 80% of the population who lives in rural, there is no screening. In countries outside of India, there are mandated screening program which is driven by insurance, which is not there in India. So some of the challenges which we face, if I take specifically, one of the killer disease today is breast cancer, which is affecting every woman today, every family. Of course, the breast cancer, we all know that can be cured completely if detected early. But unfortunately, as I said, the lack of screening protocols, national screening policy, we don't have, and because of that, there is significant women who come into very late stage detection of breast cancer, which is the biggest challenge today we have. And the statistics are actually alarming. I mean, I would say alarming is an understatement. If you look at 280 million women are in the age group of less than 40. And all of us know breast cancer today is prevalent even in younger women. Okay? In fact, the statistics say Indian women have at least 10 years early incidence of breast cancer compared to any other country. So with all these statistics, the 280 million women does not even have a screening protocol or a screening device today, because today the gold standard screening is an X-ray mammogram, and it is not recommended for women who are less than 45 because it is X-radiation. So that is the challenge today, and even women who are going for screening are even less than 1% today, less than actually 2%. But statistically, if you take the rural women, it is almost negligible. This statistics is more towards urban women. And the irony is, patients or women who goes for screening goes in a stage where they already see a lump or they are already seeing some abnormalities in their structure, which forces them to go for screening. And by that time, it is too late. The statistics, actually, if you really see, it is 70%, which is women who goes for screening, 70% go to a stage where it is stage 3 and stage 4. And all of us know the later you get into, the chance of survival in 5 years comes down drastically. So that's again, I mean, if you look at countries outside of India, take for instance US, which spends about 18% on GDP on healthcare, the statistics is 90% of the women who are detected on breast cancer is able to survive completely. and compared to India, it's about 50%. So, which is what we are trying to disrupt. Is there a way today, can we do a protocol or a screening protocol which will be very different to what we are today? The other major challenge, though you see the number of mammograms today in India, which is considered the gold standard, is less than 2,000. For a population of about 400 million who are eligible women above 40 to do breast cancer screening program, there are only less than 2,000 mammograms, which means if I have to do a WHO or a protocol followed by US or any other European standard, every 2 years a woman is supposed to go for a screening, which means we need actually close to about 30,000 mammograms to serve our country. But is infrastructure the only problem? If you really look at it, infrastructure is not the problem, because if today all these mammograms, there are about 2,000 mammograms, we ourselves have installed about 200 plus mammograms, and most of these centers don't even do less than 50 patients in a month, less than 3 patients per day. By statistics, they should do 300 patients per day if there are only 2,000 mammograms.
Actually helps us to isolate the clinical areas, amplify the tissue changes, and make sure the diagnosis is perfect. So we have an accuracy which is 97% of over 5,000 patients, and these are done at 6 different institutes. So it's not that we have done it in one institute and we have taken up the data shown across. So what do we talk about in this case is we actually measure the physiological data. That means what happens, the first thing when you have a disease is your temperature varies. So that's what a thermometer tells you. Similar to that, the physiological data here, that means if the blood vessels or any of those are able to carry some of the information, we are able to detect much early, very early as such. We'll show some of those data over here. Since we don't do any radiation, since we don't do any injection, it can be done for all patients of all ages out there. And we also, one of the issues of X-ray mammography has been dense breast. And typically in countries like India, women have more dense breast than elsewhere, which is statistical data which is there. So we do not have the issue of dense breast issues, which are there with X-ray mammography. With X-ray mammography, when you add dense breast, the what you call it about the accuracy, clinical accuracy drops below 70%, significantly below 70%. We don't have such issues here. We are also talking about like what Bala talked about. We said there should not be any pain. So that means we can't compress the breast, we can't do any of what the other modalities does. We are not talking about touching the patient, which is because one other thing is breast is the most sensitive part of a woman. So if an external person wants to touch it, it creates a lot of fear. It also creates a lot of changes in it. Then the exposure of breast. So what happens is that you could see the design. The patient does not expose themselves in front of any new person out there. We are also talking about non-invasive in the sense there is no, we don't send any drug or anything to amplify those changes in the tissue. So it's pretty safe. So women of all ages could be done, and it is repeatable. Since we read only the temperature map from the breast skin, it can be repeated a number of times. There is no restriction. Today, if you do an X-ray mammography, you are not supposed to subject the patient again to X-ray mammography within 6 months until it is clinically required. In MR mammography, you are subjecting the patient to some sort of contrast to amplify the changes. So you can't do the patient again within a quick span if you want to repeat it. So these are the highlights which I have talked about, so in the various slides, so that's captured here. So when we're talking about, what are we talking about? We have been able to detect at sub-millimeter, that's 0.2 sub-millimeter point of it. That's around 0.2 mm, we have been able to detect changes which are there. And since we acquire the breast tissue, the images in a fashion which is similar.
And as you go from the nipple towards the chest wall, the temperature keeps changing. Because we are going to the chest wall, the temperature will keep changing. So this is the normal pattern. And I think I am just educating you people, though you are not medicos. But if you get this pattern, you also know the temperature gradually changes. Such a device, if it is available at primary health center, any paramedic can diagnose any subtle changes and can refer the patient for higher centers. Now, if this pattern is lost somewhere, you know the breast is not healthy. Now this is a abnormal breast. Just compare with the opposite side and you will see there is some area where it is starting from here, this is, and in the center you can see there is a huge high temperature. Okay? The same findings were correlated with MRI. And what you get on the left side, one small nodule. This is a breast cancer. As a layman, as a non-medico, just by seeing at the thermogram, I am sure you will tell, yes, that breast is abnormal, that lady needs further investigation. You are not saying it is a cancer, you are just saying it is unhealthy breast. That is what is required from a screening device, and thermography is capable of detecting unhealthy breast. Again, MRI also is not telling that this is cancer. It is again showing that there is some problem, structural abnormality. The diagnosis of breast cancer is made only with biopsy. The biopsy was done from the breast, and yes, it was diagnosed as breast cancer. This is another case. Now I am going for a screening. How do you take it? Now ultrasound, structural, physiological structure. This was done in April 2017. What you see, again, if you remember that previous image on the left side, this pattern is not visible. You are seeing this is the temperature scale. So the temperature is mentioned about the color. So the half of the breast is showing some abnormal temperature. It is in the range of 31 to 32. Definitely it is not normal. The temperature change is there. The nipple also is slightly higher. But this is a physiological imaging. Immediately you compare with the normal breast and that breast with ultrasound.